Hi, my name is Namit Chugh. I am a principal with W Health Ventures. When it comes to healthcare investing, I think a couple of interesting things have happened in the last 7 to 10 years. The first kind of investments in healthcare were largely in multi-speciality hospitals. Then came the first wave of digital health innovation, where we saw companies in e-pharmacy, teleconsultations, diagnostics, which were trying to solve or digitize existing workflows. And now what we see going forward is the emergence of vertically integrated single specialty care delivery models. What I mean by that is companies which are building in single specialties, going after a particular disease area and going deeper and deeper. This could be across spaces like diabetes, mental health, oncology, so on and so forth. These models are typically tech-enabled and omni-channel in nature. In healthcare, two emerging trends that we have witnessed that will shape the future of healthcare in India. First is emergence of vertically integrated single specialty models. What I mean by that is companies that are building in single therapeutic areas and going deeper and deeper to capture the entire patient lifetime value. Just to give you a few examples, this include areas like diabetes, which can be built in an asset-light fashion, areas like mental health. These are typically tech-first, digitally enabled models, but do have an omni-channel approach, which means that they also cater to patients offline as well as online. The second most important trend that I witnessed today is more tech-first companies which are building from India for the rest of the world. This could be across artificial intelligence use cases, generative AI use cases, healthcare IT services companies, etc. I think the startup landscape in healthcare, if you see, there were less than 1,000 companies in healthcare in 2015, and now that number is close to 9,000. So there's definite increase in adoption, more and more companies coming up, and these companies are trying to solve for patient problems across the value chain. What has happened is more consumerization of healthcare. Patients want to keep their health at the fingertip using a mobile phone, and because of this tech adoption, more and more startups have emerged in the last several years. And I think the time for healthcare has kind of now emerged thanks to COVID. There has been immediate penetration of tech adoption both on the consumer side as well as on the doctor side, which is leading to scale up of all these companies that we see. I think the fundamental challenge that I have seen in healthcare startups is building trust, because patients are habitual of going to their neighborhood doctors or GPs, and now suddenly using services of a tech company which is offering healthcare is one of the challenges that I have seen in healthcare. So startups should kind of address that element. What that means is that they should try and have a clinician at the core of what they are building. Essentially have a clinical advisor or a chief medical officer who can then support the services, help lay down the clinical protocols. The second most important element is these startups in healthcare should focus on clinical outcomes. For instance, in diabetes, HbA1c reduction is the parameter that startups should look at. So keeping in mind the clinical outcomes for your patients is going to be absolutely relevant for healthcare companies. As a healthcare investor, I think two or three important things that we always keep in mind. First is that we need to have a longer gestation period given the nascency of healthcare in India. These companies will take anywhere between 5 to 7 years to create a strong trust, brand name, and hence scale up will take its sweet time. So as a healthcare investor, you need to be patient compared to some of the other sector investments that we see. I think the second most important challenge that we see is patient trust slash NPS slash customer love. These are all facets of the same problem statement. We need to see that patients are coming back to the app or the startup and using their solution consistently. Only then can we capture the lifetime value. So that is an important parameter that we see. And third is clinical outcomes. As a healthcare investor, that is the core of what we see across all our companies and keep a very, very close eye on. It could be pain reduction score for a pain management company. It could be HbA1c for diabetes. It could be depression reduction scores for mental health, and so on and so forth. W Health Ventures is a $100 million fund started close to 3.5 years back. The intent of the fund is to invest at seed and Series A across both India and the US. The thesis that we back is twofold. First is companies that are building in new age single specialties. This could be in spaces like urology, oncology, pediatrics, pain management, things where we have seen large clinical white spaces and no disruption has been made so far. The second part of the thesis is really around building companies in the technology space, both from India for the rest of the world and also from India for India. This could be in artificial intelligence, generative AI, and healthcare IT services, so to speak. In diabetes, we have invested in a company called Beto, which has a very smart glucometer device which captures the patient's readings on a day-to-day basis and then helps them manage their diabetes using a care program and a health coach. In mental health, we have invested in Visa. It's a mental health AI company which is a conversational chatbot. What it does is that for a large number of people, you don't really need a therapist or a psychiatrist, but you just need an emotional support to chat with. So Visa provides a conversational chatbot. Another company in the pregnancy space is Milo. It's a community of pregnant and trying to conceive women who can talk to each other and discuss their challenges. So it's a content community commerce platform, one of the largest in India today. Those are some startups that we have invested in India. We also have a company called Reveal Health Tech, which is a healthcare IT services company which is solving for product and technology challenges in the US, but building with a strong technology team in India. Those are some notable and recent investments that we have done. In future, we continue to stay excited about single specialties. Some of the recent investments include Nivan, which is a pain management company building in the MSK pain space. We also have invested in Elevate Now, which is an obesity company taking a medical weight loss approach to the complex problem of obesity. In future, we continue to back similar companies in new areas like pediatrics, like oncology, urology. These are spaces where we haven't seen disruption in Indian healthcare for the longest time, and can we build asset light single specialties is the question that we try to address as we invest in companies. The second part of our investing thesis is actually coming in very early. For that, we have very recently launched a venture studio called 2070 Health. The intent there is to work closely with the founders even at the research stage and then kind of help them scale cheaper, faster, better by putting in operating teams for support. We have built out pillars across marketing, product, technology, GTM, all these areas that founders typically would struggle early on. So these are all the support pillars that we have provided to the founders from day zero. We have incubated 3 companies so far, and the intent is to launch 3 to 4 companies every year for the next couple of years.